The gastrocnemius strain is an affection of the medial head of the gastrocnemius or soleus, and also Achillean tendon. Occur frequently in women and athletes older than 13 years old. Occur in activities like hiking, basketball, and gastrocnemius strain occur because have a vigorous propulsive movements like plantar flexion. Also is associated with fatigue or playing more consecutive days than usual. Produce rupture of the musculotendinous unit of gastrocnemius strain are swelling and ecchymosis and painful spasm. And the physical exam, the most important is point tenders, swelling and ecchymosis. Motion is limited. The foot is plantar flexion, and this no need radiographic examination. And the treatment of gastrocnemius strain are gradually brought into a neutral position and maintain it with paced posterior spring, hot spleen in a place, local compression and application of anti-inflammatory, and for finally, anklet cannot be moved from plantar position.
The leg fronteni tooth should be placed in a compression grip. The ankle should be in the position of the gravity assisted to the plantar flexion, and also occur when the athlete sits on an examination table with a handing over the side. The most important finding on examination is a lack of the reflection test. This is a thorn. A calfish is resulting in a positive Thomson test. There is also substantial loss, strange at the plantar flexion, and resulting in impossibility towards the horizontal tooth, and often even to balance to the after legs. The athletes can usually demonstrate modicum active anti-plantiflexion by using an accessory plantar flexion and the peroneal and the posterior tibial.
Physical examination, swelling and tenderness over compartment at early signs. Pain is also typically exacerbated by specific compartmental muscle testing. Initial treatment consists mainly of the rest and the application of ice. The compression is contraindicated. Any constricting clothing, baguettes, cuts, and the light should be removed or split. This is realized in these first etaps, first when present this injury. And finally, talking about the definite treatment. If symptoms since and intracompartmental pressures improve white reds and icing, definite treatment not by required. However, more severe cuts require decompression. For example, I have realized, for example, fasciotomy. Thank you. Physical examination. Swelling and tenderness over compartment at early signs. Pain is also typically exacerbated by specific compartmental muscle testing. Initial treatment consists mainly of the rest and the application of ice. The compression is contraindicated any constricting clothing, baguettes, cuts, and the light should be removed or split. This is realized in these first etaps, the first when present this injury. And finally, talking about the definite treatment. If symptoms, signs, and intracompartmental pressures improve while rest and icing, definite treatment not by required. However, more severe cuts require decompression. For example, I have realized, for example, fasciotomy. Thank you.
History. Mechanisms of injury virtually all these conditions are the result of unaccustomed activity or overuse. For the runner, increased mileage, alteration in the training, and the change of shoes are the most common cause. Specific things with an activity are often associated with this problem. With nearly all overuse injures the body, the athlete, the less change required do cause the problem. This for the national level figure skater a mid-abdominal 10 minutes. A dive practicing a new jump can result in a stress fracture of the field. Mechanical abdominate, such hyperpronation of the foot are the often noted have not been known to have predictive importance. Thus, for example, is training running with the tibialis posterior syndrome and excessive foot pronation with mic prescribe orthes, but they certainly would not suggest that a runner with pronation should have orthosis to prevent this condition. Symptoms. The primary symptoms for all these conditions is pain. The painful period gradually enters into the work times. The athlete presents for treatment. Symptoms are present during the activities of daily living. Localized swelling may accompany stress fracture. Diffuse swelling, often described as a tense sensation, sensation in an anterolateral aspect of the subject, and a compartment syndrome, as does the presence of a small in occasion only described by patients with chronic compartment syndromes. Graphic examination. Anterior, posterior, and lateral radiographics of the legs often reveal stress fractures that have been symptomatic for the more than 3 to 4 weeks. The presence of dense areas of focal posterior steel thickening is sometimes seen only with oblique radiographics. An actual fracture line is rarely seen except in transverse fractures of the anterior means of the tibia.
Definitive treatment. Perform frequent stretching exercise of the twin and solid muscles. Perform muscles stretching exercise with the help of TheraBand approximately 10 repetitions. At the beginning of the treatment, the exercise should be done with only 10 degrees of the range of movement to avoid possible injuries. The athlete can resume his activity until he manages to maintain 20 seconds on the tip of this foot. Balancing, walking 20 minutes quickly. The patient with tendinitis is a candidate to have the evaluation in a knee. This can be corrected with orthotic device. Templates can be managed in the heel to decrease the tension in Achilles tendon.